Welcome to our call, everyone. Thanks for joining us. My name is Adam Raymond. I'm the communications director at KyPolicy, and we're here to talk today about the fast-moving federal budget and tax proposals that are moving through Washington. Um, we have, okay, so you can hear me. Okay, so we have a few other members of staff on call today. Hopefully the slides are advancing and you can see we're going to talk about the key elements of Medicaid, SNAP, changes to taxes, and the timeline for what we should see over the course of the next couple weeks. And so we will start it off by handing it over to Dustin Pugel.
All right. Hey, everybody. Again, I'm Dustin Pugel. I'm the policy director here, and I'm going to start off by talking a little bit about the largest source of budget cuts, which comes from Medicaid and other healthcare programs. So I just want to sort of say top line, this is the largest budget cut in Medicaid's history. It's actually so large that it's larger than all previous cuts to Medicaid combined. And the Congressional Budget Office, the nonpartisan office that works for Congress to score things like this, estimates that there would be an increase in 13.7 million more uninsured Kentuckians because of it. It then cuts to the Affordable Care Act marketplace. So, this is really significant. If you have read our work before, some of the ways in which they were going to attempt to cut this, they've sort of abandoned, but they've moved in another direction that I think would be just as harmful. So to start out, there is a mandatory work reporting requirement being proposed. There are a lot of sort of details and nuances to that, but the bottom line is that as many as 282,000 Kentuckians could be at risk of losing their health insurance under this. This is kind of a unique requirement too, in that it's not just that you need to be employed moving forward, it's that you would actually need to be employed starting the month before you become you attempt to apply for Medicaid. So in places like Georgia, where a similar policy was implemented, there are around 240,000 Georgians who are eligible by income, but there's only about 5,000 people who have been able to navigate the paperwork to become eligible. We know that most of the enrollees on Medicaid who are adults in the expansion group already do work. It's just the paperwork of proving that ends up tripping people up. And it also doesn't end up with any more employment or increased wages. A few other things, they're talking about increasing the number of times people have to recertify who are in the expansion group, meaning prove that they're eligible. Right now, that's on an annual basis. This would increase that to every 6 months. When we unwinded from the public health emergency a couple of years ago, as many as 10 to 20% of the entire population was disenrolled from what are called procedural errors, which again are just either late paperwork or paperwork with errors that were not addressed. So it's another really concerning opportunity for people to fall off of health coverage. Another would be the first ever copay for people who are on Medicaid. This is anywhere between a $5 to $35 charge that they would be required to provide at the point of service before they receive health care. This is a way not of recouping costs in Medicaid, but of actually preventing the care from being provided, which generates a pretty large amount of savings when you're not going in for routine checkups or other types of treatment, let alone more serious types of healthcare provision. There would also be new paperwork requirements through what's called the delayed enrollment eligibility rule. CBO estimates that by itself could result in 2.3 million fewer people covered by Medicaid. There are also some other more technical changes, such as frozen provider taxes, reducing the amount of time prior to eligibility that you could get retroactive coverage, which just means Medicaid pays for your bills typically 3 months before you become eligible. This would shorten that to 1 month, might make it more difficult for providers to offer care to people who are likely Medicaid eligible but not currently participating in it. And it also expires existing enhanced subsidies for folks who buy health insurance on the marketplace. So we call that Connect. Other people call it a health insurance exchange. So in other words, let's say you do lose your Medicaid coverage because of one of these new paperwork requirements, it would actually become more difficult and more expensive to afford coverage on the marketplace. So this adds up to a lot of folks in Kentucky being at risk or potentially losing coverage outright. And it also results in more expensive coverage in general through copays and fewer subsidies on the exchange. So with that, I'm going to pass it over to my colleague, Jessica, who's going to talk a little bit about the changes to SNAP.
Thank you, Dustin. Hi, my name is Jessica Klein. I'm a policy associate focusing on food assistance. And I hate to sound like a broken record, but it's the same story over here in SNAP. This is the largest rollback in food assistance we would see, taking food away from many of the 575,000 Kentuckians that participate in SNAP. And one of the biggest ways we would see that is a shift to costs to states. So the SNAP program has always been 100% federally funded in terms of benefits. There was an administrative cost share, about 50%. That cost share is being increased to 75%. And then states would also see costs of benefits. So the costs are dependent on error rates. And we're not sure which year they're going to choose or if it's a stretch of years for those error rates, but we're looking at about 5% to 15% of the cost of SNAP for Kentucky to pay for. And if that's 15%, that's about $190 million per year. And if you follow our work, then you know that that would be difficult for Kentucky's budget to fill that gap. In addition to the cost share, which is very new, something we've seen over and over again is our work reporting requirement in SNAP. Currently, there's a work reporting requirement for families 18 to 54 without dependents or children or people with a documented disability in the home. And that means that they have to report work. And what we know about these work reporting requirements is that they're inadequate. They have very ineffective at increasing earnings or employment, but are very effective at taking people's benefits away. So this would increase work reporting requirements to people up to the age of 64. The age is currently 54, so up to 64, and including families with kids over 7. And for that group, it's really people who are not married or that both parents don't meet this requirement is what we're looking at. So that's an estimated over 135,000 Kentuckians whose food assistance would be at risk. So that's about 23% of all of the people that participate in the program. The other part of the proposal is that it would limit the state option to waive this work reporting requirement in areas with too few jobs. So currently in Kentucky, we're able to submit data to the USDA to have areas where there's proven joblessness waived from this additional work reporting requirement, all of this paperwork. And this is being changed to only counties where unemployment is over 10%, and currently there aren't any in Kentucky. It also caps current and future SNAP benefits by freezing the Thrifty Food Plan. So the Thrifty Food Plan was determined in the 2018 Farm Bill, and it was really charging USDA to recalculate how SNAP benefits are calculated. And it took into consideration, new nutrition guidelines, the cost of food, and food consumption data for the first time in 50 years. And through this change in the Thrifty Food Plan, people were able to see an increase of about $1.40 per person per day, which doesn't sound like a lot, but it increases benefits to about $6 a day, which for a lot of people, that makes a big difference. So what this would do is limit and cap benefits to the amount that the Thrifty Food Plan has calculated by stopping any further adjustments based on, again, these nutrition guidelines and food costs. So really over time, that would make SNAP benefits more inadequate and really out of reach for what people are really seeing in terms of market rates. Another piece that this proposal does is eliminating the SNAP education program. This is the program that provides nutrition education and obesity prevention, really that health education to SNAP participants. All states are required currently to have a program. In Kentucky, it's administered by University of Kentucky and Kentucky State University. So this program would be completely eliminated. Again, just a disinvestment from the people that participate in this program. And there's a few additional technical pieces in terms of what this proposal has, which one is it narrows how states can calculate utilities which go into the SNAP benefit calculation. There's currently a lot of simplifications, and this is a state option that states can opt into. Kentucky opts into it. It minimizes paperwork and the red tape that families have to go through in terms of submitting paperwork to get all of the benefits that they are eligible for. It also excludes internet from this calculation, which we know is just not modern capacity. People need internet as kind of one of those basic needs in terms of the SNAP benefit calculation. And finally, within this proposal, it also ends SNAP eligibility for some legally residing residents. So that's immigrants, granted asylum, refugees, and that's about an estimated 7,000 Kentuckians that we would see lose benefits from that component. I feel like I need to say the caveat that the Agriculture Committee is still meeting as we speak, and that's on YouTube. They're discussing, I think there's 13 maybe different amendments at the moment, so more to come on all of this proposals. And I will turn it over to my colleague Patience to talk about taxes.
Thank you, Jessica. Yeah, my name is Patience Martin. I am KyPolicy's State Tax and Budget Policy Fellow. I'm going to be talking a little bit about the proposed tax plan. Unfortunately, a lot of the devastating cuts to the programs that my colleagues provided are coming due in part to this tax plan being pushed that would overwhelmingly benefit the wealthy and offer sweeping tax cuts that would inevitably come at the expense of such vital programs like SNAP and Medicaid. The budget bill being pushed forward largely focuses on extending a lot of the inequitable tax cuts that were put into place in 2017. So it would be making permanent changes to the income bracket changes, as well as tax cuts that resulted in the richest 20% of Kentuckians receiving literally double the share of cuts than what the bottom 80% combined received. And this was not even taking into consideration the fact that within the proposed tax plan, there are new loopholes and giveaways being included for the wealthy. Some of those new changes skewed towards the wealthy include things such as an increase in the deduction for wealthy investors through what is called the pass-through deduction, an increase in the estate tax exemption, which largely only benefits high-income, high earners, and it would also exclude about 323,000 Kentucky children from receiving full or any benefit at all of the temporarily increased child tax credit. Additionally, it offers new tax breaks for foreign profits for large corporations, and also creates a profitable tax shelter for private school vouchers, which is coming right after Kentuckians just worked hard to defeat Amendment 2 in our last election to protect public school funding. Similar to Jessica's caveat, there is the caveat with this that we are still receiving new info all the time and continue to update our analyses. But essentially, this tax plan would provide sweeping tax cuts across income groups that at face value could benefit any average Kentuckian. However, they are providing those benefits largely skewed to the wealthiest of Kentuckians, and are coming at the cost of cuts to programs that people rely on every day just to get by.
Dustin, you want to take the timeline?
Yes, sir. So for those of you who were not paying super close attention during the American Rescue Plan Act or before that, we are in what's called a budget reconciliation process. This is a really Byzantine process with a lot of steps, and we're still relatively early on in that process. Essentially, what has happened up till now is that the House and the Senate have agreed on a roadmap for what types of spending changes need to happen. And now we have moved into essentially what's called the committee markups. There are still committees meeting right now as we speak. Most of them started yesterday, and at least one did not get through all of its work before the early hours of the morning. So when that is complete, though, what we anticipate is that next week, starting on Monday, there will be what's called a rules committee. There may be a few additional changes that take place during that time, but their hope is to have a full vote maybe by Wednesday or Thursday of next week in the House to be able to finish up the House's work prior to the Memorial Day weekend recess. Once that's done, it'll go over to the Senate, and they'll go through a very similar process. The Senate committees will do their own markups, and they could come up with what it looks like a very different bill than what the House has put together at this point. Sometime in June or July, the full Senate would take a vote on it. And the goal is to have this completed before the August recess, in part because it's anticipated that the US government will hit the debt ceiling sometime while they're out of town in August. So their desire is to have this all finished by then. We've already seen them miss a couple of their own deadlines, though. And so all of this timeline comes with an asterisk. And for those who are sort of interested in advocating for this and would like to reach out to their legislators, I really encourage you to take heart from that fact, because we know that the more pushback they get, particularly from their constituents, the longer this process gets dragged out and the less likely a lot of the cuts that you've heard about on this call will go through. So with that, I'm going to hand it back, I think, to Adam to wrap us up here before we take some more questions.
We're going to try Natalie again because I believe she's back with us.
We're going to try. We're going to have a solid attempt. I'm seeing hands saying, yes, you can hear me. Thank you all again for being with us. And obviously, this is an emergent situation. Things will be changing, but the time is now to contact your legislator. There is a lovely QR code up on your screen, as we do have a Action Network campaign. You can join with hundreds of other people across the state and signing on those letters, really pressing our lawmakers to do what's best for Kentucky and to defend these programs and reject the kind of tax cuts for the wealthy that we're seeing in these bills right now. On your screen, obviously, is a list of all of our legislators that we would like you to be contacting right now. But you can also, again, use this QR code. The Action Network link is in the chat as well to utilize that. So again, obviously, we are in an emergent situation right now where our lawmakers need to hear from us. They need to hear how important Medicaid, SNAP, and all of these other programs are for our state. And as Dustin just said, we'll be in this through July. But they need to hear from you now, because by the time we get to July, that window of speaking your mind will be closed. So please do call your legislator, sign on to that letter, and thank you all so much for being with us. We are now in the space for questions. We do have some coming in the chat. But I believe that we're just utilizing the chat for questions, or are people allowed to come off mute? I'm not sure if they have that ability.
I don't think so, Natalie. So if you want to
MC
the question.
So the first question I'm seeing in the chat, what does it mean when they say they want to shift costs to the states? Does that mean Kentucky would have to come up with roughly $22 billion? Thanks, KyPolicy, for the info. And that the federal government currently supports. So I believe Jessica or someone else could answer that for us.
Yeah, I can jump in initially. So a lot of the ways in which they talked about potentially shifting costs to the state, they did not go through with, particularly around Medicaid. One example in Medicaid, though, is the inability to create new provider taxes in the future. If healthcare costs go up and the state wants to try and be able to absorb those costs through increased provider taxes, they would not be allowed to do so under the bill. Another example that Jessica mentioned that I'll briefly say and see if she wants to add anything to is this first of its kind shift to requiring the state to pay a portion of SNAP benefits. SNAP benefits each year are in excess of $1 billion. And what they're discussing could be asking Kentucky to pay 15% or more of the cost of that, which could be, if you're doing the math, anywhere between 160 or more $1 million. That's a lot of money. That's more than, for example, what we spend on the entirety of the University of Louisville. It's nearly double what we spend on public preschool in the state. So it's a real significant amount of money that the state will have to make up or else try and find a way to absorb elsewhere. So Jessica, is there anything you wanted to say about that?
Yeah, and I think Dustin covered it well, but I do want to say the other option that really comes to mind in terms of states trying to come up with this money is that they will also have to shrink programs. That means finding ways to reduce the number of people that are participating or reducing eligibility altogether for certain groups. So that's definitely part of the risk that we're taking with shifting costs to states, is that people will lose assistance.
Thank you all. We have a question that I'm sure, since we are in this ever-shifting situation, we may not have an answer for, but if passed, when would this take effect? I do know we can answer that, but how many Kentuckians would be kicked off of Medicaid? And will we be able to send these slides after the fact is also a question. Oh, and how would this affect rural hospitals?
Those are all really good questions. So different parts of the bill take effect at different points in time. So if this were to pass, and that's still a big if, work requirements would begin starting January 1st of 2029. Mandatory co-payments would start in October of 2028. The increased number of redeterminations would start October of 2027. So it's kind of all over the place. The tax changes also start at different points in time. So it's really hard to say when exactly, the whole thing would be fully phased in. Suffice to say, they're working off of a 10-year window. So in order to generate enough savings to be able to offset, again, a portion of the tax cuts that they're talking about doing, a lot of these would be implemented on the early side of that window. Obviously, there's a new election next year, and then there's another election in 2028. So I think part of the timing there is also trying to avoid blowback in the near term when people start rolling off. In terms of the number of people who are going to be kicked off of Medicaid, that's difficult to say, again, because we know how many people would potentially be at risk from a new work reporting requirement. I've seen estimates that say as many as 280,000 people would be at risk. Potentially 120 to 130 could be kicked off because of it. If we look at just the redeterminations, we have an idea of how many could be losing coverage based off of prior experience with the public health unwinding. 60% of folks who lost their coverage lost it because of paperwork issues, which again is what we might see under a situation like that. So we have national partners who are still trying to create a more comprehensive estimate of the impact of all of these. So the closest thing I can point you to is a national estimate of around 13.7 million people. And it's difficult to know how that translates to a state level. I also see a question, and how would this affect rural hospitals? So, a lot of the effect here would be indirect. It kind of depends on how many people lose health insurance. If we look at the types of jobs that are available in rural parts of the state, I think it's likely that it's more likely that people in rural parts of the state would lose health insurance. So in that way, they could be hit harder. If there is an inability to improve on the state-directed payments that we're currently providing to rural hospitals, That could be another way that it would eat into their bottom line. And then obviously, when people are not seeking care because of these copays, those are services that are no longer going to be reimbursed for. So we know that rural hospitals have a thinner operating margin than urban hospitals, and so they were probably more likely to be impacted by these cuts. Even though, I put on my slide, this is death by 1,000 cuts. A lot of these things may be on the smaller side, but they add up very quickly.
Well, we are getting to time. And so I wanted to say, Nick Holmes and Bart Irwin, if you all want to put your emails in the chat, I'll try to get those questions answered for you. But I believe that our call is going to end right at 3:30. So I wanted to wrap us up. Thank you, everyone, again for joining us. Again, if you can drop your emails in the chat for those questions that were lingering, we'll try to see to those. We appreciate you. And there was a question about, calls that aren't getting through. The best thing I can say is to try to sign on to our letter so that there's more people all at once demanding that we protect these programs.